And welcome back. Well, I'm one of many people who struggle with chronic back and neck pain. So today we're going to talk about what causes it and how to treat it without drugs or surgery.
Dr. Kurt Simons is with Care Health Center with more. It's very, I'm sure, encouraging to people to think that they, especially for people who suffer years in, years out, to think you can get relief without drugs or surgery.
It is. There's new alternatives, there's new treatment programs, and that's one of the things that we're doing within our clinic.
So what causes it? Is it most of the time that someone's had an accident or whiplash or something like that?
Most of it's just small things that build up over time. A lot of people you'll talk to say, well, it's just my, it's my normal back pain. And I ask them, what is normal back pain? There is no normal pain. So it's just little things that build up, and a lot of times the body will compensate, so the pain will go away, but it keeps coming back. If it keeps coming back, then you've got more of a problem.
Or does it sometimes radiate to other areas
You can have radiating pain. For example, if you have neck pain, you may get arm pain. If you have pain in the back, a lot of people, you'll hear the word sciatica, they may get radiating pain down the legs.
Okay. What kind of trends are you seeing now with chronic pain?
Chronic pain over the last 20 years has doubled. It's gone from 5% to 10%.
Wow.
Low back pain is the #1 reason why people miss work. Over 8 million people every year miss work because of it.
Yeah, what about the treatments for chronic pain, especially for people who've maybe tried other options or treatments?
Because the problem's becoming more prevalent, the treatments are becoming more aggressive. The use of narcotics in the last 20 years has increased over 400%.
Wow.
Surgery, they're finding that people who have a fusion surgery, 25% of them within 5 to 10 years are having a second. So it's a real big problem.
So what kind of treatment are you using, and how is it different?
We use a combination of chiropractic and physical therapy, and it allows us, when the disc thins and begins to degenerate, what you need to do is get it to move. You need the bones to move. So we use physical therapy, and because we use a type of system that allows us to get the patient pain-free, we can do exercise. Because if you can't get them out of pain, you can't do the exercise, but the exercise is what you need to do to get the disc to heal.
We're going to hear from a patient right now of yours. This is someone who had chronic pain,
Yes.
right? And what was the answer for her?
For Jennifer, we put her through the program, and it's been a lifesaver for her. I'm sure her words will be better than mine on this.
All right, let's take a listen.
A couple of years ago, I was diagnosed with a herniated disc in my lower back. It was herniated to the left, and it actually ruptured, and it affected the nerve going down my left leg, and I was in an excruciating amount of pain. I could not sit, I could not stand, I could not walk, and so I spent most of my days basically laying in bed in a whole lot of pain, and I was taking a lot of pain medication because of it. So I decided to give Dr. Kurt's herniated disc program a try, and it was amazing what we did. It allowed me to slowly get better, and I was able to continue with physical therapy and things like that to help strengthen my core and get myself feeling better. I decided at that time that I did not want to have any invasive procedures, such as I did not want to have any surgery on my back, and I did not want to have any injections in my back. And so this program has actually been able to get me to the point where I'm back to full function. I'm able to do everything that I've always been or wanted to do prior to the injury, and I have not had any problems since. I'm fully functioning and happy and back to my life, and I was able to do that all without having any invasive procedures. And so I can't be more grateful to Kurt in the program.
I bet it's really rewarding to hear people say that. There's something specific called functional disc rehydration. Is that one of the options?
That's the technique that we use in our clinic, and it's a way to rehydrate the disc to get its health back, to get that bulge or herniation, whatever you want to call it, to come back in and get off of the nerve and relieve the patient of their pain.
So who's a good candidate? We hear her story, and it sounds, I think a lot of people can relate to that. You're starting to have different pains or shooting pains, or you've been told you have a herniated disc, those types of things. The
first thing we'll look at generally is an MRI. We'll have the patient come in, we do a consultation, we'll talk about what they've done, where they've been, have they had a recent MRI done. If they have, we can use that. If they haven't, and they meet certain criteria, then we'll send them for a new MRI. Based on the results of that, we'll determine if they're a good candidate for the program or not. Not everybody qualifies, but we'll do do our groundwork to make sure that they do.
Yeah, and to think that you qualify for something that doesn't require drugs or surgery.
Yeah.
What about whether or not it's covered by insurance?
Most insurance does cover what we do, and that's part of the consultation process with the patient. We'll check their insurance benefits, so if they do start care, they know exactly what their cost is going to be prior to starting.
That's
nice.
wonderful.
And
Yeah,
you do free consultations.
Yeah, we do free consultations because it breaks down a barrier. It allows them to come to the office. There's no promises on our end. There's no, nothing they have to worry about. We'll talk to them and see if they are a candidate for the program before we charge them anything.
it's fantastic. For a free consultation, a complimentary consultation, you can call Care Health Center right now. It's 262-246-3000. You can also check out this website for more about relieving back and neck pain with functional disc rehydration. That website is wibackpain.com. Good to see you again. Thank you.
Good to see you. Thank you, ladies.
Thank you.